The scale of childhood obesity across the world has been revealed in a study which found 1 in 5 children are now overweight or obese.
But experts estimate that in Aotearoa it's more like 1 in 3. Grace Thomas has more.
Takeaways, fizzy drinks and junk food are more visible and accessible than ever. And the impact it's having on Kiwi kids is clear.
It is really bad with obesity with our children here in Aotearoa, New Zealand.
The global study by China's Sichuan University found rates of obesity have climbed drastically over the last 10 years, along with a worrying prediction that by 2025, around 206 million children will be obese. It's an issue Aotearoa has long been grappling with. New Zealand has the third highest rate of obesity in the OECD and the second highest rate of childhood obesity. And those issues carry on into adulthood, leading to chronic health conditions and putting more pressure on the public health system.
They can have some joint issues, there can be self-esteem issues, and also, of course, the increasing risk of type 2 diabetes.
A Massey University research program is trying to do something about it and specifically reduce rates of obesity in Pacific families. Nearly 28% of Pasifika children are classified as obese. Part of the program involved trialling a healthy food box along the lines of My Food Bag.
We made sure that the recipes were familiar to the families, also very easy to prepare, and we very much encouraged the families to include the children in part of that meal-making process.
While the results haven't been published, Latu says it showed promising signs. Some experts say for the issue to really be solved, it needs greater government intervention to prohibit advertising sugary drinks and unhealthy foods.
Especially around sports events, on their way to school, or even going to church on Sundays for many of our Pacific children. There's lots of advertising.
So that would mean seeing fewer ads like this on our streets. Grace Thomas, Newshub.